Here we go. Welcome to today's, well, it says Medicare 201 on the slides. I think we advertised it as 102. I'm transposing my numbers a lot on that. Okay. I'm not going to mess with anything because I'm afraid I'm going to blow it up. Let's see what happens if I hit. Okay, hold on just a second. Okay, that'll work. No, it won't.
Yeah, I already got it.
Let me try this. Lets me know the meeting's being recorded. Why don't I have a mouse? I have got it on the screen. Yeah, there's the mouse on the screen. Thank you. It wasn't right. There.
Zoom, I don't either.
Good.
Work, then I'm just gonna navigate from my computer.
Okay. Okay. All right. So we covered the basics of Medicare, what it is, federal program provides health care to people 65 and older for disability. Got the 4 parts: Medicare A, B, C, and D. It is run.
All right, sorry, guys.
It's run by the Centers for Medicare and Medicaid Services. And the eligibility for Medicare is determined by the Social Security Administration. Part A has a deductible based on your benefit period. Part B has an annual deductible. C is a combination of Medicare A, B, and usually D. So it's everything wrapped into one. It's an A, Medicare Part C, also known as Medicare Advantage, is an HMO, basically, PPO type situation on that. CMS, I don't think we discussed this last time. Centers for Medicare and Medicaid Services. There is not a CMS office that you can go to. There's not a CMS office that you can walk into. You can go to a Social Security Administration office. But there is no CMS office that people can just walk into and conduct their Medicare business. See, that's why Social Security has become the administration that is in charge of doing the eligibility, because they kind of go hand in hand on that. So you can walk into a Social Security office, they can determine your eligibility for Medicare. Are you 65? Are you disabled? Have you been disabled for the amount of time that is required in the statute? And they can get you hooked up with your Medicare. If you have any questions about Medicare, about the insurance, or will Medicare cover my piece of durable medical equipment, Social Security is going to be no help to you. And they're going to tell you that directly. But we don't do that. We just determine if you're eligible. If you're eligible according to the rules, we send your information to CMS and they can take it from there. So that's why being SHIP counselors is so important, because people don't have anybody they can go talk to about this. So what we talked about last time was the basics. We talked about A, B, C, and D, what it is, you know, how do you enroll in Medicare? You know, you want to get a hold of them before you're 65, get all that taken care of. So now it's like, okay, we've got all that information. What do we do with it? So you're getting ready to retire. I asked last week, what's your retirement going to look like? And you got a whole bunch of different things up here. You got guys going fishing, a couple going to Machu Picchu, climbing the mountains, spending time with family. I do like this, the cartoon, kind of in the middle. True, I was all for taking up a hobby on retirement, but really tightrope walking. You know, probably not the best time to take up tightrope walking. Ladies painting, travel. The bottom one with the green car, that's my husband's view of retirement. That is actually his car, and his little 24 cubic foot trailer. Now, let's talk about this a moment. This is where you have to, if you have a significant other in your life, whether it's a spouse or somebody you like to spend time with, you need to agree on what your retirement is going to look like. He loves his little car. I think his little car is fantastic. He even had my initials put on the passenger side of the car. So his initials are over here on this pillar, and mine are over on the other one. I didn't ask for that. He did that. He's driven his little car to Lebanon, Tennessee, and he's driven it to Dubuque, Iowa. And he says, we're going to go out to the national parks. We're going to go to Yosemite and Yellowstone, and we're going to go to all the places in Utah, and we're going to do all this. Remember, I said this trailer is 24 cubic foot on this. And that's good. Except he drove from Collinsville, Illinois to Dubuque, Iowa. About a 3.5 hour drive in a normal vehicle. For him, at an hour, because of the car, you know, it's almost 100-year-old car. Come on, give it a break. On here. And he gets out and he's like, where's the Advil? It's killing me. He has to wear back brace when he drives it that long. And I'm thinking to myself, I want to get in this thing and ride with you out to Yosemite. You know, no, I don't think so. Put me on a plane or rent a car when I get there. You know, these are more my ideas of retirement. So he and I are kind of looking, and I said, that's okay. If you want to go do that, I'll meet you out there. No problem. I said, I also have a hotel room booked on this, because this is an entire camping rig for him. He's got a tent and everything in here that he needs to camp with. So you need to know what your retirement's going to look like. Even if you're just going to travel within the United States, are you going to be spending half the year in the southern U.S. and the other half of the year in the northern U.S.? You know, are you going to spend your summers in Vermont and your winters in Arizona, where it's warmer? Are you going to strictly stay, you know what? All my kids live in Minnesota, we're moving to Minnesota. Okay. Are you going to stay in Minnesota? Or are you going to spend the warm months in Minnesota and the cold months you're going to be in Florida? These are important questions to ask. And I'm going to explain why. In a little bit. So, other questions you have to ask. Well, right now, are you actually retired right now? Do you have retiree coverage through a former employer? Did you work for the federal government? You have coverage through that. Do you have a spouse that is still working and you're covered under their health insurance on that? Do you plan on traveling or spending parts of the year in different locations? We covered that in the last couple of slides. Okay, why am I asking all this questions? Because everyone is different. Just because your neighbor has S&P insurance doesn't mean that's the best insurance for you. Even in couples, just because one insurance is good for one person doesn't mean it's the best insurance for the other person. We find that a lot in Medicare Part D, because everybody takes different prescriptions. I have yet in 15 years to meet a couple that both take the same list of prescriptions. I would probably be rather shocked if that happens. Okay. We talked about this a little bit last time when we went over the 101 stuff. What if you're still working after the age of 55? If you are still working at age 65, you have health insurance through your employer has more than 20 employees, your work insurance will be your primary and your Medicare will be your secondary. If you're working for an employer with more than 20 employees, you don't have to pick up Medicare Part B at this time. You might as well go ahead and pick up A because it's free anyway. If you have coverage to a current employer, we just talked about that. If the employer has less than 20 employees, then you must pick up Medicare Part B. And this is where it's a little different. If the employer has less than 20 employees, you have to pick up Medicare B. And in this instance, Medicare will be the primary and your employee insurance will be the secondary. So over 20 employees, you don't need B, and your work insurance is your primary, Medicare is your secondary. Under 20 employees, Medicare, you have to have B, Medicare is your primary, and your work insurance is your secondary. On this. A little bit of more employer. Do you have it? Can you keep it if you retire? If you can keep it, is it affordable? Because a lot of places are like, oh yeah, we cover all our employees. Okay, that's great. And our employees, when they retire, can keep our company insurance. Great. Oh, by the way, did I tell you when you retire, it's going to cost you $650 a month? Or $450 or $200 or whatever it is. Is that something that you can afford when you retire in your retirement income? If you can keep it and it is affordable, is it creditable coverage? That's the one thing. We talked a little bit about creditable coverage last time also. When you're going to continue to, when somebody's going to continue to work past the age of 65, if your insurance is considered creditable, you do not have to pick up Part B. Or a Part D if they have prescription drug coverage on it. If those are both, if they're considered creditable coverage, and you should get a letter that states that. You should also get a letter that states it's not creditable coverage. If it's not considered creditable coverage, then you have to pick up B, Medicare B, and a Part D to avoid any future penalties because it's not creditable. Now, creditable means, and I don't think I defined this last time, creditable means it's as good or better than Medicare Part B or D. I'm sure you had a question.
Who determines whether it's credible or not?
Medicare.
Medicare, okay.
It's Medicare, and the companies know if they have creditable coverage or not. And they're the insurance companies are the ones that are going to be issuing the letters of creditable coverage. So if you get a letter, if you're working with people, they bring in and you read it and it says this coverage is creditable under all the legalese that they put in with that. Tell them to keep that letter in a safe place. Put that letter somewhere where they keep safe insurance paperwork. I tell people just keep it just in case. It's one of those documents, better to have it and not need it than need it and not have it on that. Okay, what happens when you retire? We go backwards or forwards? Okay. If you can retain your employer coverage, then Medicare becomes your primary and your insurance becomes your secondary. If you cannot retain employer coverage, or it's too costly to maintain, then you've got to decide what kind of coverage you do want, and you need to make the switch and get the switches put in place at that time. And most people are like, well, how far ahead do I have to do that? What's my timeline? What's this? And most people do not wake up on Monday morning and say, that's it, I'm done, I'm retiring today. Not to say it hasn't happened, Well, most people don't do that. Most people are like, okay, you know what? I'm done. I'm tired of this. And Joanne in the cubicle next to me, if she chews again, I'm gonna just lose it. And it's time for me to go. It's time for me to get out of here. It's time for me to retire. All this, and for whatever reason. So they start timing it out. They're like, okay, you know, most people want to leave their job, you know, leaving a good taste in everybody's mouth and not just walk out the door and leave everybody with a big problem. So they plan out. So it's usually, okay, I'm going to go out at the end of the month. September 30th is going to be my last day, you know, and it's the 1st of September or the end of August. Okay, great. You've got a month. So what you need to do is if you have employer coverage, that's creditable. You haven't picked up your Part B yet. You need to get a hold of Social Security. And you say, I need to enroll in my Medicare Part B plan. They have a special form for this. You're going to need to get the form. I download it too. I think I've got it bookmarked on my computer. Get it filled out. You're going to have to take it to your employer's, whoever acts as HR, if you have an HR department, or if you've got somebody that acts as HR. You need to take it to them. They need to fill it out that says, yes, Julie, from the time that she was 65 and eligible for Medicare on whatever that date was, to now, or to September 30th, 2021, has had creditable coverage through us. You take that back to Social Security. At the top of it, it says, I want my Medicare B to start. And you make sure that says October 1st, 2021. You give that to Social Security. Social Security goes, oh, that's good. You had creditable coverage and you want your Medicare B to start October 1st. Perfect. We'll file this for you and go from there with it. You're done. Now you've got your Medicare B. Now you need to make all the other fun decisions on this. This is what people ask me. What coverage do I choose? Here's my answer. I can't answer that for you. It's not my insurance. It's not my life. It's not my decision to make. My job as a senior health insurance program counselor is to answer your questions so you can make an educated, informed decision about what you want to do. My biggest concern is you're getting the coverage you need and want for a price you can afford. On that. So here we go. And what we're going to talk about in this is you're not going to have employer insurance when you retire. You're going to have your original Medicare A and B. Now we need to figure out what else you're going to do. Are you going to pick up D? Are you going to get a Medicare C, Medicare Advantage plan? Are you going to do supplemental? Here we go. So you've got an original Medicare A. Like I said, also, Medicare Part B is optional. You don't have to take it. But if you don't take it when you're first eligible, you can be penalized for it later on if you try to enroll on it. Also, if you don't take Medicare B, you're not going to have coverage for doctor's office visits, lab work, x-rays, durable medical equipment, things like that. Everything covered under Medicare B. If you don't take Medicare B, you cannot have a Medicare Advantage plan. You remember what I said about Medicare Advantage? It takes your A, your B, and usually your D and mixes it all together. Well, you don't have B, so you can't have a Medicare Advantage plan. Medicare supplementals supplement Medicare A and B. If you don't have B, there's nothing to supplement. You know where I'm going with that? On that. So you can just have Medicare A, or you can have Medicare A and B, or you can have Medicare A, B, and D. Remember, Part D is also optional. But again, if you don't have Part D, you don't have anything covering your prescription drugs. Or you can have a Medicare C plan, with or without prescription drugs. Some will come with prescription drugs, some will come without. This is something we didn't cover the last time either. Why the difference? Medicare C with prescription drug coverage. Everything is in one nice neat package. You have one card, you have one company you're dealing with. Everything's great, one. Everybody likes that simplicity. I don't have to think about which card I have to give to whom. I have a Medicare Advantage plan. I give them my Medicare Advantage card, whether it's a doctor, a lab, or a pharmacy. But if you like your doctors and your hospitals and all that, and all that's great, but their prescription drug coverage changes and it's not covering your medications as well. If you have a Medicare Advantage plan that has both A, B, and D, you can't just get rid of the D. You have to get rid of the whole thing. But if you have a Medicare Advantage plan that is just covering A and B, but just covering your hospitals and your doctors, and you pick up a separate Medicare Part D, and the Medicare Part D changes, you're like, oh, okay, I'll get a new Medicare D. But my doctors and my hospitals and all this are all okay over here. Or maybe your Part D is doing great, but the doctors change, or the hospitals change, or the company says we're not contracting with that hospital anymore, or the hospital says we're not contracting with that company. And you want to get something that covers your doctors and your hospitals, but you want to keep your Part D. If you've got them separated, you can do that. I know it's confusing. If you have your A and B in a Medicare Part C plan, and you have a separate Part D, you can make individual changes. You can adjust as needed. Because if you have them all together, if you have a Medicare C plan that covers A, B, and D, and you don't like the hospitalization part of it, but you like the prescription drug, well, sorry, you've got Aetna and you want to go to Humana, sorry, you got to throw it all out and go to Humana on this. But if you had your hospital, if you had a separate Medicare C and you had a separate Part B, you're like, okay, I don't like the hospital on this, I want to go to Humana. You can get the Humana Medicare C without prescription drug and keep your Aetna prescription drug.
Okay, I see. So like A, B, and C is much more flexible than A, B, C, D.
Yeah, it's a little more a la carte.
Okay.
So instead of getting the plate, you can kind of get it a la carte on that.
And you can change.
During enrollment periods. Okay, next option. This is old school, a little more. This is Medicare A and B with a standardized supplemental plan. And this is what a lot of our older Medicare beneficiaries are used to. This was what it was around. And I remember my parents and my aunts and uncles having discussion with my grandparents about their supplemental plan on this when I was a kid. This has been around. Well, what they did in the 80s and 90s is they standardized them. Because, you know, this company was offering this list of stuff, and this company only offered this. So you're like, no. Here's what we're going to do. We're going to standardize these plans. And they lettered them. A, B, C, D. So it's a little confusing when we get to Part D. Because there's a D supplemental and then there's Part D on that. But they lettered them and they said, okay, a standard Part A supplemental, a standard supplemental A plan is going to cover this. And a B plan is going to cover this. And a C plan is going to cover this. And Medicare left it up to the companies to decide which of those lettered plans that they wanted to offer. But if they said, okay, we're going to offer them all, that's fine. With a supplemental, and I'm going to say this once again, and it drives me crazy to have to do it. This is the standard. This is the norm. For every norm, there's an exception. And there are some exceptions and some changes that have been made in the last few years with supplementals. But for the most part, if what we do with supplementals is we talk to somebody and say, what do you want it to cover? And there's a nice chart. The Illinois SHIP puts out a supplemental guide every year, and I believe it's page 7, has a little chart. And it has it listed. These are all the things that can be covered by your supplemental. These are all the different plans. You go down and you go, yeah, this is the one I want right here. I want the one that does this. So I want a G plan. Okay. Once I decide which plan I want, then I can go look at all the insurance companies that offer a G plan. Because now the only difference I'm looking at, my coverage is going to be the same. I'm getting a supplemental G plan. I don't care if it's Mutual Omaha, United Healthcare, any of the other Humana, whoever, Blue Cross Blue Shield that offers supplemental plans. The coverage is going to be the same. What's different is the price they charge me. And you would be surprised. For the same coverage, you can have several $100s a year worth of difference in premiums. So that's where you can start. That way you can compare apples to apples and not apples to, Java fruit or kiwi or something on this, but you can actually cover. So you can have a Medicare A and B with a standardized supplemental. Or supplementals do not cover prescription drugs. They used to. I think they're all gone now. They did that before Medicare Part D existed on this. So you have A and B with a supplemental. You can have Medicare A, Medicare B, Medicare D for your prescriptions and a supplemental. And you can have Part A and B with employer retiree coverage. These are your options. This is your food bar to choose from. Now you talked about retiree coverage through spouse, either working or through their retiree coverage on this. There's also Medicaid. If a person can't afford a supplemental, they're on limited, maybe they're on SSI only, supplemental security income, which has a monthly cap of around $800 a month. You're definitely not going to be paying for any additional insurance out of that. On it. That's why Medicaid exists, is to help people in that situation. You can have Medicare, you can have Medicaid. You have to meet income and asset limits. Assets can't be more than $2,000.
You say that,
Assets can't be more than $2,000. Income changes depending on what the household is. Assets do also on this. There's also a way for married spouses, one to qualify for Medicaid if they need services, and the other one not to. It's called spousal impoverishment. We're not going to go into depth on that at all. Okay. We kind of talked a lot about this Medicare supplemental stuff anyway. It's a supplemental. It supplements. It fills in the gaps. Think of Medicare as a can with holes in it, and you fill it full of sand. Sand's going to come out of those holes. Basically, what a supplemental does is wrap around that and cover the holes you want it to cover. That's why you choose what you want. Premiums. This is where we get into the big difference between supplementals and Medicare Advantage plans. A majority of Medicare Advantage plans don't have any additional premiums other than your Part B that you pay. That comes out of the Social Security check. Supplementals all have premiums. You can have a premium as low as $50 a month. That's going to be a supplemental plan with a very high deductible. It's going to be a high deductible plan. And they can go to over $200. The other things about supplementals premiums is premiums change year to year. So some premiums are based on the age you are when you get the supplemental. Some premiums are based on what they call attained age. So you get it at age 65, and from 65 to 70, your premium is the same. From 70 to 75, your premium will jump up. From 75 to 80, your premium will jump again. Every time you attain the new age bracket, premium goes up. Most supplementals will increase yearly. It's cost of living. All of our house insurance, car insurance, all 9 yards on this. Beneficiary is responsible for premium payment. There's going to be nothing, Medicaid's not going to help you pay this. There's nothing that's going to help you pay this. Now, that being said, if you know somebody with end-stage renal disease, they need to get a hold of the American Kidney Foundation, because the American Kidney Foundation will help pay for Medicare supplemental for end-stage renal disease patients on that. You pick the coverage. We already talked about the chart. And you go through, you pick what you want it to do. And we already talked about the fact that once you pick what coverage you want, the difference between the companies is what they're going to charge you on this. Billing of service for supplementals. Billing for services goes to Medicare first and then to the supplemental company on that. You may have some deductibles. There's a couple of the plans that pay percentages. So they'll pay a percentage of your Part A deductible. They'll pay 75%, but you're responsible for 25% on that. On this, there is no enrollment period. You can switch to a different supplemental anytime during the year. You can do it January, pick a month, you can change your supplemental on that. Your insurance agent calls you and say, hey, listen, I just got the new rates for this company and it's going to save you $75 a month. You want to switch. Oh yeah, I want to save $75 a month. Yeah. Or no, I don't like that company. Their commercials are annoying. I have had people tell me that. I'm not taking their insurance. Their commercials annoy me. Okay. This is just a base breakdown for some base numbers on what it would cost to have a supplemental plan. So supplemental plans, a lot of them start around $125 to get a month. Part D plans, national base average is $33.06 a month on that. Your Part B premium, which you still have to pay, comes out of your Social Security checks, $148.50. So your total for having a supplemental for a month is $306.56 on that. Most people say, well, I don't count the Part B because I never see that. It comes out of my check. I never get that money. Yeah, you don't count it, but you're still paying it on there. So it still counts. It also counts as income on it. Okay. Medicare Advantage plans, Medicare Part C. We've already talked about it. It's a combination of A and B or combination of A, B, and D. Companies have contracts with Medicare. So there's certain things they have to cover. There's certain ways they have to cover it on this. You still, and this is something, this one, pink one here, you still have all the rights, privileges, and protections of original Medicare if you enroll in a Medicare Part C plan, a Medicare Advantage plan. C. You enroll in C, you still have all the rights, privileges, and protections of original Medicare. I cannot tell you how many people have come and go, I don't have Medicare anymore. Excuse me? Nope, I'll get rid of my Medicare. I got this. And they slide me an Essence card, which is a Medicare Advantage plan. But no, you still have Medicare. You're just getting it. I tell people it's kind of like ordering a pepperoni pizza. Traditional way to get it cut, for me at least, is in triangles. But you can also cut it in squares. It's the same pepperoni pizza. I just cut it differently. I'm having it served to me differently on this. That's what a Medicare Advantage plan does. You still have Medicare. You still have all the rights, privileges, and protections. You're just getting your services in a different manner on this. Majority of Medicare Advantage plans have no additional premium above the $148.50 you're paying for Medicare B or Medicare beneficiary. I keep saying you, like I'm assuming you're all Medicare beneficiaries on this. Okay. Medicare Advantage plan, yeah.
I'm just curious with the advantage plans, if the services are just getting kind of cut up in a different way, like pizza. So that would also include any benefit that they would have with like mental health mental health services as well.
Yeah, mental health services are covered under Medicare C. Let me get through this slide, and then we're going to go back and compare a supplement to a Medicare Advantage plan and make it a little more clear. So Medicare Advantage plan, you have networks of doctors, hospital labs, pharmacies. Most of us are used to that. No, I can't go see that doctor, he's not in the plan, or he's at a higher tier on this. Plans require co-pays for services. You go see the doctor, you pay 5, 10, 15, 20 bucks. You go see a specialist, you're gonna pay probably more on this. The billing with supplementals, I said, the billing goes to Medicare first, then it goes to your supplemental company. With a Medicare Advantage plan, the billing goes to the insurance company. Medicare never sees the bill, because the company's doing it. You're getting your service through the company, not directly through Medicare. Medicare's still backing you up, but they're not doing the day-to-day on that. You have specific enrollment periods. Supplementals, you don't have an enrollment period. You can do whenever you wake. You wake up and the Mutual of Omaha commercial ticks you off that morning. You're like, that's it, I'm getting rid of them and go back from Preston's. Tell your insurance agent. Enrollment period, we're getting ready to come up on the annual enrollment period, October 15th to December 7th. You can start, stop, or switch your Medicare Part D. January 1st to March 31st, you can drop Medicare Advantage plan and return to original Medicare and a Part D, or drop an existing Medicare Advantage plan and pick up a different one. Those are your enrollment. Let me double check what this next slide is. Okay, I'm going to go over the costs of Medicare. So, cost for Medicare Advantage plan. December, don't look right. I'm sorry. This total on this slide under cost in Part B, total 135. I didn't change that number. This 135.50 should be 148.50. Sorry, I missed my updates on that. So, get a Medicare Advantage plan, has no additional premiums. The cost for you, and this is, we're going to say this is a Medicare Advantage plan that covers A, B, and D. No additional premiums. You're going to pay your 148.50 Part B, and that's it. You're done. Thank you for signing up.
A, B, and D.
We're going to say it's an A, B, and D one.
Yeah, okay.
On this. And then you're looking at one of them, and most of these companies have like their gold, silver, platinum, or silver, gold, platinum. I guess the correct way to do it on this, and you can pick, or Humana Advantage, or whatever they're called, GHP Advantage on this, and they may have some additional benefits. Maybe they're covering a little bit of dental. Normally with dental, it's like 2 cleans a year and a set of x-rays, but it still covers that. They may have some vision in there where they cover a new pair, $100 to a new pair of glasses every 2 years or something. Now, all 4 of us in the room are wearing glasses, and we all know that it costs more than $100 to get a pair of glasses on this, especially when you get older and the doctor looks at you and says, well, you need 2 different prescriptions because you can't see up here and you can't see up here, and you're doing the trombone slide. Took me until last year before you said that to me. And he goes, well, you can have bifocals, you can have progressives. And I said, I'm too vain for bifocals. And he goes, I'm proud of you. You admit that. So it might get some extra stuff here, and they might cover some more things. And they may have some other perks that they throw in. Maybe they've got a silver sneakers program, which pays for like a gym membership to different places on that. So you've got your Part B $148.50 premium, and then there's an additional $45 premium. So you're gonna pay $193.50 a month. $148.50, that's gonna come out of your check before it even gets deposited, and then you pay the company the $45, and you're done. Now, both of them, one of them's almost half the price of having a supplemental, and the other one's, a third less than having a supplemental. So why in the world would I pay over $300 a month to have coverage when I could pay $150 a month to have coverage? Yes.
Because with supplementals, you can stay with your current doctors.
That's one thing, you can stay with your current doctors. The other thing is, you look at this and you look at what you're paying upfront in premiums. Then you have to look at how are you going to use this? Do you have a lot of medical expenses? Oh yeah, I'm going to the doctor once a month, twice a month. All this, and I have this special procedure done, or or I have a history of this, or I have a history of that, or whatever it is. Versus the guy who doesn't take any prescriptions, considered healthy as a horse, goes to the doctor once. I'm going to say he goes to the doctor once a year, does an annual checkup. Blood pressure's good, blood sugar's good, cholesterol's good. He eats healthy, he exercises regularly, doesn't take any prescription medication. He is not going to use it as much. Medicare supplementals are, I call it paying ahead. Because with Medicare supplementals, if they're covering your Part B deductible and they're covering your Part A deductible, you go see the doctor, you don't have any out-of-pocket expense when you go see the doctor. You don't have to pull out that $20 or write that $20 check or swipe your credit card for $20. It's covered if you have the right supplemental. The Medicare Advantage plan, you got money outlay every time you go do something, whether they get it to you when the day they do it or they bill you for it later. You've got a copay when you go see the doctor. Well, now I got to go get lab work done. A lot of lab work, if it's ordered, is usually fully covered, but there's deductibles. With a Medicare Advantage plan, we talked about with original Medicare, you go to the hospital and you have that little over $1,000 cost if you're in the hospital. The way Medicare Advantage plans work is they do a daily copay. And all the plans are different. Some plans, it's a $200 copay for 10 days. Some of them, it's a $75 copay for 20 days. So if you're in the hospital for 2 days, it's $150. If you're in the hospital for 10 days, it's $750. You're like, okay, I'm good with that. With original Medicare, you just pay that full amount up front and you're covered until you've reached your 60th day. So it's when you use it, you pay. That making sense? Okay. On that. Everybody following me that's virtual with us? I'm going to take that as a yes. But with a supplement, you're paying a higher premium, but you're also not doing the out-of-pocket outlay when you go to use the services on that. So if you go to the emergency room, you're not going to have, $200, $400 out-of-pocket when you go in with a supplemental, whereas with a Medicare Advantage plan, you will. So that's what you got to look at. You got to look at. Now, remember, always in the background, whatever you choose when you first go on to Medicare or you first retire, you are not stuck with that the rest of your life. You can change from a supplemental to a Medicare Advantage plan. You can change from a Medicare Advantage plan to a supplemental on that.
During the period of change, right?
Hmm?
During that period of October to December, right?
Yeah, you have to go, if you're doing Medicare Advantage, you have to do it during enrollment periods. So, on this. Okay, I'm gonna briefly touch on IRMA. And people have nasty things to say about IRMA. But IRMA stands for Income-Related Monthly Adjustments. And this applies to both Medicare B and D. Basically, if you make more money, you're gonna pay more in your Part B premiums and your Part D premiums. Now, don't panic. When I say more, a single individual, if you look at this, so we've got individuals over here, we've got married filing jointly. You have to be an individual making over $88,000 a year before IRMA touches you. You have to be a married couple making over $176,000 before IRMA touches you on this. So an individual and I'm making between $89,000 and $111,000 a year, I wish, in my retirement. I'm going to have an IRMA amount of $59.47. So that $59.47 is going to get added to my Medicare Part B premium of $48.50. So my Medicare Part B premium is going to be $207.90. Prescription drug coverage, I'm going to have an IRMA amount of $12.30 that's going to be added to whatever the plan charges a month for premium. So if they're charging $30 a month, my premium is going to be $42.30. Once you hit $500,000 as an individual or $750,000 as a married couple, it caps. So you don't have any more. So once you hit that, once you hit $500,000, doesn't matter if you're making 500 or $1 million a year. You're going to have the same IRMA. You can see on the second line, if you're individual between 107 and 133,000 or married filing jointly between 214, 267, your IRMA amount's the same amount as Part B. So basically you're double in your Part B amount. If I'm making that number's not right on there. It should be 111, 112,000 on there. The reason I bring this up to most people is because for the most part, this isn't a permanent thing for a lot of the people that we see. It's a temporary thing. And what I mean by temporary is if somebody has sold a piece of land or has some things, mostly we see it with like investment accounts. And things are moved around and changed and, transferred and however it works. Some of that money ends up on your tax return as income. And that will push your IRMA up. It happened to my mother. We had a piece of farmland. It was held in joint ownership. We sold it. She took her percentage. I got my percentage. She comes to me about a year later. She says, "What does this mean? Why are they charging me more for my Medicare B? What did I do wrong?" And I looked at it and I went, "You didn't do anything wrong. We just got a really good price on the farm." And so you're going to pay this amount for the upcoming year. And there's nothing we can do about it. And she was like, "Okay, yeah, I'm fine with that. That's not a problem." And I said, "Yeah, and then next year it'll go back down. Your taxes go back down." And it's kind of weird because like 2021 is based on 2019's income because the way tax years fall and when you file taxes and all this and everything gets through the system. So that's when most people feel the IRMA hit is if something big's been sold and it adds to their income. For the most part, most people aren't gonna have a permanent IRMA increase on this. There used to be a thing, if people were married and filed separately, if they file separately, they do take a little bit of a hit on this. You can see if their income is less than or equal to 85,000, they don't have an IRMA amount, they're fine. But if it's between 88 and 412,000, they've got an IRMA amount of $326.70. And it's like, well, this isn't, why, I might save more on my taxes. Okay. That saving on your taxes, is that going to make up for $326.70 a month for each of you? For your Medicare premium? And we've seen it sometimes with like one spouse has a higher income than the other one and they file separately. because they think they're getting something. And the one spouse is fine because they're under the threshold, but the other spouse is over by $5,000. And it does come back and bite. Now, this all being said, if somebody gets into a situation where they have like a one-time IRMA thing, and whatever happens, but they absolutely cannot afford that for a year, there is an appeal process that you can do. You file the appeal, you say, yes, I understand that because in 2019, this is what happened, da, 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 da. But here's what happened in 2020 that you all haven't seen yet. And I took a big hit in my, retirement income, and my income is now, whatever it is. And you give them that, and they'll say, oh, okay, yeah, you can't afford that. So they will change that. Okay, we talked about the enrollment period. We're gonna go back over them real quick. Initial enrollment for any of this is the 3 months before a person's 65th birthday, the month of, and the 3 months after. My birthday's in May. My initial enrollment period starts in February. February, March, April, the month of my birthday, June, July, August. So I have from February to August to make a decision. Whatever I do last is what sticks. I can change 4 or 5 times in that period. Whatever I do last is what sticks. Now, it is better to have it done before the month of your 65th birthday. If you do it the month of your 65th birthday or one of the months, you may have a little drag time in getting things established. Is somebody trying to ask a question?
No.
Okay, we're good. All right. On that. So that's the initial enrollment period. Also, during the initial enrollment period, you cannot be denied coverage. I don't care if you have brain cancer, end-stage renal disease, AFib, and are type 1 diabetic. Doesn't matter. You cannot be denied coverage, whether for your supplemental or anything. After your initial enrollment, you can, for a supplemental, you can be subjected to underwriting. From experience, from what I've seen, for the most part, if you've had a supplemental and you're going to move from Blue Cross Blue Shield to Mutual of Omaha, and you've had Blue Cross Blue Shield coverage for 5 years, you're just going to move companies because Mutual of Omaha is going to give you a deal. They're usually not going to underwrite you because you had coverage that entire time. You haven't had a lapse or anything on that, but you can be subject. And I want people to know that up front. If you go to do that. Okay, annual enrollment, like we talked about, starting October 15th right through December 7th. This is the time period to start, stop, or switch your Medicare Part D, whether it be just a Part D plan or Medicare Advantage plan with prescription drugs. If you haven't picked up a Part D plan and now you decide you want one, you can do it at this time. General enrollment and Medicare Advantage enrollment are for the same time period, January 1st, March 31st. General enrollment means if you didn't enroll in Medicare Part B when you were first eligible and now you want to, this is the time you enroll. The problem is it's not going to start till July 1st. You just need to keep that in mind. Medicare Advantage enrollment, you can drop your current Medicare Advantage plan and go back to original Medicare and a Part D plan, or you can switch from one Medicare Advantage plan to another Medicare Advantage plan on that. Okay. Coverage choices are varied, depend on the individual and their circumstances. Questions can be answered by a ship counselor who is not trying to sell you anything. You come in, you ask us questions, we give you hopefully answers on this, or we tell you we have to go look up the answer on this. It is your Medicare, so they are your choices. Flat out. Again, you are not stuck in your first choice. If your needs change, then your coverage can change also. It may not change as quickly as you'd like it to. You may have a change in June, and you can't make a change until October 15th, which won't take effect until January 1st, but you can change. That's the thing. People come and they say, well, here's my medication list. Well, my doctor's been talking about putting me on this medication and switching this medication to this medication, and he's thinking about maybe having me try this medication too. Okay, I can't work with what ifs. I have to work with what you're giving me. You're giving me a medication list. This is currently the medication list you are taking. I can't tell you what's going to happen. If we try to do every combination of everything that your doctor thinks they want to do or have you try, you're going to be sitting at my desk for 2 weeks. Because as we go through everything. So we have to base it on the prescriptions the person's taking now. Now, does that mean if the person comes in and sees us on October 15th with one medication list, goes and they make a decision? Now, yeah, I want to switch over to this plan. And then on November 1st, they have a massive heart attack. They come out of the hospital, they come see you on November 20th, and they're like, I got 5 more prescriptions. And he switched on them. What do we do? Okay, we do a new plan finder. We do a new plan finder. We're like, okay, the plan you enrolled in, or we're going to enroll in for January 1st, is not going to work well for you now. These are your 3 options now. Well, yeah, I want to do that. Then we're going to do it. Now, we're probably not going to do it through the Medicare.gov website. We're going to pick up the phone and we're going to call our super secret SHIP counselor hotline that we have and use our super secret SHIP unique ID number. And we're going to call Medicare directly. And we're going to say, hey, listen, Mr. Jones came, we did a plan finder October 15th. He was on the ball, got everything taken care of, and he enrolled in this plan. And they're going to say, yes, we see that in the system. Here's the problem. Mr. Jones had a heart attack November 1st. He got out of the hospital. He came to see me. He has 6 new medications and 3 changes of his old medications. He needs to enroll in this plan to start January 1st. And they're going to say, okay. And they're going to go through the whole enrollment procedure and do it.
Are you allowed to do it because you're still within October 15th to December 7th?
Correct. Remember what I said about our initial enrollment period. I can make any decision I want. I can make 4 or 5 changes. What I do last sticks. That's what happens with annual enrollment period, October 15th to December 7th, and the Medicare Advantage period between January 1st and March 31st. Whatever you do last sticks. If you do a secondary change, I like to call Medicare directly because I don't want to leave it up to strictly the computer system. I've seen too many little bitty glitches happen. I also, by the way, do not do Medicare counseling sessions the first week of annual enrollment period. Because in the 15, 16 years I've been doing this, every week, the first week, the computer system goes down. And you've got a week's worth of appointments scheduled and you can't do anything because the system's down. We don't even schedule appointments the first week. We go with the second week around here. Okay, who can answer my questions about my coverage? Sure. You can also call CMS yourself. It's an 800 number, 1-800-Medicare, and you can ask. I would tell you the people answering the phone are working off the script. If you have an oddball question that doesn't follow their flow chart and their script, you're going to have trouble getting an answer. You can call the 1-800-SHIP line. You can call the Illinois Senior Helpline. They're going to say, where do you live? You're going to say, I live in Belleville, Illinois. And they're going to go, oh, wait a minute. Okay, we got a SHIP counselor at PSOP in Belleville, and we got SHIP counselors at H. Martin O'Fallon, and they're going to give you our number. You can also call us directly, 618-222-2561, and they can say, I live in Washington County. We're going to give you the SHIP counselor in Washington County. I live in Clinton County. We're going to give you the number for Clinton County Senior Center. I know that because they're the only SHIP counselor in Clinton County. On that one, you call me, tell me you live in Bond County. I'm going to say, okay, there's a SHIP counselor at the Bond County Senior Center, and there's also a SHIP counselor at the Bond County Health Department. On that, I'm probably not. The receptionist is going to do that. I'm not taking time. Every state in the country has a SHIP, and they may not call it that. Florida calls theirs Sunshine. Missouri calls theirs Claim. But a lot of them still call it SHIP. Kansas calls theirs SHIP on that. Again, SHIP counselors do not work with or for any insurance company. We're not getting kickbacks. Blue Cross Blue Shield or Aetna or Humana, they're not giving us money because you've enrolled with them on that. And we've even signed documents with the state that say that we don't do that on that. This is a big old write-up about what SHIP does. We've already talked about what SHIP does, but this is their little write-up and their little logo. So you know you're talking to somebody at SHIP on this. How do you contact us? There you go. 801 West State Street, O'Fallon, 618-222-2561. We have 3 full-time staff who are SHIP counselors. Melanie, Missy, and April. There are 2 more of us who are SHIP trained and kind of work as backup on that. Myself being one of them, Taylor Grimm being the other one. She's one of our compliance specialists who mainly works directly with our grantees, providing services. Like I said, you can come see us. You know, we don't care if you live in Chester and you don't want to go see the SHIP counselor down in Chester because you don't like local people being up in your business, and I have heard that one too. You come see us, we're fine with that. Or we'll give you the closest one outside of Chester, you know? Maybe you'll go to Sparta and see the one in Sparta on that. It doesn't matter, 7-county area. Actually, we'll see if you're from outside the 7-county area. Doesn't matter to us on that. We also do phone. We found out that yes, you can do SHIP counseling over the phone during the COVID pandemic because we had no idea how we were going to get through last open enrollment period. But we managed to do it. We did it by phone. People were given the option of doing a virtual or a Zoom if they wanted to. So that's where we're at with that. Any questions?
There aren't any F and Gs anymore, or
Any what?
that like a G plan and an F plan, do they not exist anymore?
Yes, they do. Yeah, here it is. Here's the rules and here's the exceptions. F plans still exist if you had one before January 1st of 2020.
Oh, okay.
If you had an F plan, you can keep your F plan indeterminately.
My mom has a G plan.
G plans kind of came in and took over for F plans. But yeah, if you had an F plan at the time, you can keep it on that. And Abby, we can quit recording. As long as nobody online virtually has a question for me.
I have one question. If you could clarify, I'm planning on working past 65. So when can I actually sign up for Plan B?
You want to do it as soon as you know when you're going to retire.
And then I just
So-
take that to Social Security and whatever date they come up with, I can start it then. Is that right?
Correct. Now you have coverage through your current employer.
Correct.
Okay. And yeah, and it's considered creditable coverage.
Probably, yes.
Okay. As long as you have that, it's considered creditable coverage. Yes, when you go to retire, as soon as you know when you're going to retire, so if you decide, you know, May 1st, hey, I'm going to retire at the end of August, you can go in, you can file that, you can get the paperwork form, tell them, hey, I want my Medicare B to start September 1st of this year. And they'll have you take the form to your company, to your HR person. They're going to verify that, yes, you had insurance between the age of 65 and whatever August 30th of that year is going to be. And then you submit that to Social Security and they will issue you a new Medicare card. Because I'm assuming you're going to go ahead and get your A when you're eligible
Correct, yes.
on that. But yep, that's it.
So that is the one exception to the enrollment periods then, I take it.
Correct. That is one of the exceptions.
Yeah, okay.
There's a whole bunch of other ones, but that's the basic exception.
Okay, thank you.
You're welcome. Anybody else online have a question? Okay. And then Abby, we can quit recording if you haven't already stopped.